Why King Charles won't reveal his specific cancer type. Despite positive health update in Stand Up to Cancer message, King Charles III has become increasingly open about his cancer journey, sharing a hopeful update on his treatment during a pre-recorded message. Aired on Channel 4's Stand Up to Cancer broadcast on December 12, 2025. The 77-year-old monarch announced that his cancer therapy schedule will be reduced starting in the new year, crediting early diagnosis and effective medical care for this significant milestone. Yet, despite this candor, one key detail remains private: the exact type of cancer he is battling. In the heartfelt video, filmed several weeks earlier at Clarence House, Charles described his diagnosis as overwhelming, but emphasized the transformative power of early detection. Today I am able to share with you the good news that thanks to early diagnosis, effective intervention, and adherence to doctor's orders, my own schedule of cancer treatment can be reduced in the new year, he said. This milestone is both a personal blessing and a testimony to the remarkable advances that have been made in cancer care in recent years. Testimony that I hope may give encouragement to the 50% of us who will be diagnosed with the illness at some point in our lives. The announcement sparked widespread relief and admiration, but also renewed questions about why the king has chosen not to disclose the specific form of cancer. Buckingham Palace has consistently explained that this is a deliberate decision, guided by medical experts and the monarch's own wishes to support the entire cancer community, rather than focus attention on one particular type. A palace spokesperson told Hello. The advice from cancer experts is that, in his determination to support the whole cancer community, it is preferable that His Majesty does not address his own specific condition, but rather speaks to those affected by all forms of the disease. This approach ensures his message resonates broadly, avoiding the risk of skewing public focus or resources toward a single cancer type, a phenomenon known as the celebrity effect in oncology awareness. The palace has only confirmed what was stated earlier. Although the cancer was discovered during treatment for benign prostate enlargement in January 2024, it is not prostate cancer. Beyond that, details remain guarded, reflecting a balance between transparency and personal privacy amid intense public interest. Charles' diagnosis was announced on February 5, 2024, after tests following his prostate procedure revealed a separate concern. Since then, he has undergone regular outpatient treatment, described as weekly sessions, while gradually resuming a full schedule of duties. The reduction in treatment intensity signals a precautionary phase with ongoing monitoring, but the palace avoided terms like remission or cancer-free, opting for measured language to manage expectations. This cautious terminology is not unique in the royal family. Princess Kate announced she was cancer-free in 2024, before later describing herself as in remission in January 2025, prompting similar public confusion about the distinctions. Medical experts clarify that cancer-free typically means no detectable disease after completing treatment and tests, while remission indicates diminished or absent signs, with follow-ups continuing to monitor for recurrence. Charles used bowel cancer as an illustrative example in his message, highlighting how early stage detection yields survival rates of 9 in 10 over 5 years, dropping to 1 in 10 when found late. He also promoted the new National Screening Checker tool for breast, bowel, and cervical cancers. However, sources confirm these references are educational, not indicative of his or any royal family member's condition. The king's openness has been gradual but purposeful. From pausing public duties briefly post-diagnosis, to resuming hospital visits where he empathized with patients. It's always a bit of a shock, isn't it? Charles has humanized the monarchy's health challenges. His ability to maintain an active life, including overseas tours, has been a source of personal encouragement. As the palace noted, Prince William reflected on the family's trials during an Apple TV Plus appearance on The Reluctant Traveler, with Eugene Levy calling 2023-2024 the hardest year I've ever had. He praised his grandparents' longevity and resilience, but acknowledged life's unpredictability. When you suddenly realize that the rug, the metaphorical rug, can be pulled from under your feet quite quick at any point. By not specifying his cancer type, Charles ensures his story inspires across all diagnoses, avoiding unintended consequences like overwhelming specific support services, a concern raised by oncologists. When high-profile figures disclose particular forms, this strategy aligns with his lifelong advocacy for health and environmental causes, now amplified by personal experience. The Stand Up to Cancer message, reaching millions, serves as a powerful call for screening uptake. Amid 9 million overdue in the UK, as 2026 approaches with reduced treatment, Charles' journey offers hope without overpromise. A monarch's measured path through vulnerability that continues to unite and uplift the nation.